Hello, in this video, I'm going to be talking about phyllodes tumors of the breast. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, often in response to questions you've asked. And in fact, today's topic is one that several of our commenters have asked us to speak about. And that again is phyllodes tumors. It's possible that you've never heard of this type of tumor in the breast. It's very rare. Fewer than 1% of breast tumors are phyllodes tumors. It's a funny word, isn't it? It comes from the Greek word leaf, because the pattern of the cells under the microscope look actually like leaves. Phyllodes tumors are interesting. Instead of arising from the ducts or the lobules of the breast, they arise from the connective tissue, the things that hold all those cells in place, which is very different from what we think about as breast cancer that most of our other videos talk about. Phyllodes tumors are classified into one of three groups: benign, borderline, and malignant. Most phyllodes tumors are benign, the vast majority, meaning they won't spread to other parts of the body, and that the problem is just restricted to the breast. That is not in any way to minimize the problem with phyllodes tumors.
Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at Yerbba.com to take control of your breast cancer journey.
Phyllodes tumors can actually grow very quickly, and that can be really frightening. And unlike these asymptomatic tumors that we can't feel, most people feel these tumors in the breast. And again, they're so quickly growing, even when they're benign, that the skin can stretch. They can also be picked up on ultrasound or mammogram, but most people come to medical attention before they have a screening test. It's after they're found to have a mass that imaging is done. So by imaging, I mean pictures of the breast. That can be with MRI, ultrasound, or mammogram. Once they're discovered, a biopsy is done. They can look a lot on imaging like a fibroadenoma. So a biopsy absolutely must be done of any rapidly growing hard mass in the breast that doesn't come and go with menstrual periods, for example. A biopsy can help reveal if this looks benign under the microscope, borderline, somewhere in the middle, or malignant. As I mentioned, most phyllodes tumors are benign. So we've talked about benign tumors. They don't look aggressive. The cells are not rapidly dividing under the microscope. Borderline means they fall somewhere in between benign and malignant. Malignant phyllodes tumors have many more cells that are dividing. When a biopsy is done, the tumor is fixed, and that stops any division from happening. Under the microscope, we can see, is the DNA splitting into two? Are the cells dividing into two, even if they're not actively dividing, because the tumor has been fixed with formaldehyde, and then placed into paraffin. How do we treat these tumors? The key thing we do is treat them with surgery. So if the tumor is benign, a wide local excision can be done. If the tumor occupies a large portion of the breast, a mastectomy may be indicated. A lot of people with borderline and malignant tumors proceed to mastectomy because the biggest risk is recurrence in the breast. We want to get all that tumor out, even if it's just borderline. So we take as much of the tumor as we can, and then a normal rim of tissue. And again, sometimes that means we have to do a mastectomy. Mastectomy is removal of the breast. Phyllodes tumors, despite being rapidly growing, are rarely seen in the lymph nodes. So the decision about lymph node surgery is based on imaging and the physical exam. Radiation therapy might be offered to somebody with a malignant tumor. We don't discuss estrogen therapy, anti-estrogen therapy. We don't talk about HER2 therapy or even staining. And chemotherapy, which we use for other types of breast cancer, is not effective, nor is it needed for the vast majority of people with even malignant phyllodes tumors. If chemotherapy is needed because the tumor is spreading, and I have to tell you that's exceedingly, exceedingly rare, we use chemotherapy that's more typically used for soft tissue sarcomas, which arise from the connective tissue, just like phyllodes tumor. If you've had a phyllodes tumor, we'd love to hear from you. What was your experience like? What questions do you have? Feel free to put comments or questions below. We get back to you within 1 to 2 weeks. We respond to every comment, and I want to thank you for watching.